Hello everyone, I'm a retired occupational therapist. I'm experiencing some hand pain due to trigger finger from prolonged grasp of a weed eater, which you want to rest your hand frequently if you're doing something like that, or you might develop what's called this trigger finger. And as you can see right here, these tendons right here are popped up and there's adhesions on it, and you can feel there's knots on them. So adhesions will form inside the sheath of a tendon where a tendon glides. When you move your fingers, the tendon glides back and forth, but when it's trying to slide over this adhesion, it gets stuck and you'll feel like a snapping in your finger. Some people's fingers get totally like frozen where it's way down here and they can't release it. Mine now is not snapping anymore because I've been working on it. But if you develop this, do not get surgery until you try exercises, exhaust everything else, because the hand is the most complex biomechanical system in your body. It works off of a pulley system. The tendons, when they pull, they close your fingers, and when they relax, they open your fingers. But also muscles act as a physiological pump, and every time you move a joint, there's a synovial membrane by each joint that pumps that fluid back towards the heart area, and that's why it's important to keep your hand elevated when you do this above your heart level. But you can see I have swelling right here and right there. That's edema, where it goes to try to rescue the injured part, because our body's so smart, it's carrying nutrients, but that can be real painful and cause stiffness. So if your finger is snapping or it's even stuck, what you do is get to the base of the finger that's the problem and put a lot of pressure right here, and then open and close it, and it will allow that tendon to pass through without snapping or triggering, which is what you want to avoid at all cost. Now, you might only be able to do it in increments until it gets a little looser, because as you do this, you're giving your fingers a lube job, because of what I said about the synovial membranes increasing or releasing fluid every time you move it. So motion really is lotion, okay? So you want to do it like that and do it in increments. You can even put it on top of a table and like you're scratching until you get it loosened up. And then there's another exercise. You can put it on the table and lift them up a little bit. The fingers are effective, and then bring them up and hold 1, 2, 3, 4, 5, and come down a little bit, up and hold 1, 2, 3, 4, 5, and that stretches out that area around the tendon sheath, which allows it to become more flexible. The texts all say immobilize with a splint, but I find when you immobilize your whole finger, it causes more stiffness, more swelling, more pain. It becomes a vicious cycle. So if you want to prevent that one joint from triggering, which is the one that's closest to your palm, you can get a ring, one of these long rings like this, and put it upside down and put it over your finger, and then it will prevent it from closing all the way and prevent that snapping. And then you can simply just take the ring off if you want to wash your hands or something. You can also get like pipe insulation and build up handles of knives and forks and things like that, tape it around there to build the grasp up if it's hurting your hand real bad, until you work on this and get it alleviated. And if you do these exercises, as I said, it will improve the symptoms greatly. I've been working on it. It's been like going on 6 months where I'm just now able to prevent it from snapping now. But it was snapping pretty bad, and it was pretty painful. So I hope this video helps you, and if you have any questions, feel free to drop a comment. Stay blessed.